Welcome to Native Americans for Community Action. My name is Cheryl Bly, and I'm the Director for Community Development. There are two Substance Abuse and Mental Health Service Administration grants, also known as SAMHSA grants, under the Community Development Department. They are called the Reach Your Life Suicide Prevention Program, and the other one is called the Circles of Care Program. The Reach Your Life grant provides youth support and suicide prevention programming through Coconino County and the Hopi Tribe. The program is designed to reduce the rates of suicide and suicide attempts within these communities. Interconnected goals have been developed to improve the increase in outreach, access to services, resources, collaboration, and surveillance. The goals encompass a collaborative effort addressing mental health, behavioral health within suicide prevention.
Hi, I'm Brenda Mathai. I work with Reach Your Life. That's the suicide prevention program here at NACA. I am the Brief Intervention Care Coordinator and responsible for Zero Suicide at NACA. Zero Suicide is a systematic approach to prevent suicides and to help people who are at risk of suicide. At NACA, that means we have integrated behavioral health with primary health by co-locating them. And we have a policy for all of NACA that to ensure that clients or patients or consumers receive a screening each visit they make to NACA. And with that screening comes an intervention if the screening is positive for depression. Once the screening occurs, we then will do an assessment for suicide risk, and if need, we will take them through protocols, which is a treatment plan called Collaborative and Management of Suicidality. With CAMS, we will help the client resolve their suicidality and help them to understand the drivers. We also provide regular mental health therapy. Once the suicidality is resolved, we then move into regular mental health therapy where we can offer substance abuse treatment or treatment for trauma, and also help develop goals for them, for the client. The other portion of what I do is training that goes along with Zero Suicide, and that's workforce preparedness training. That training entails either Safe Talk, which is a 3-hour training, or ASSIST. And ASSIST is Applied Suicide Intervention Skills Training, and it is a 2-day training. In both these trainings, people who are caregivers, alert caregivers, learn to conduct interventions and refer the person at risk to someone who can increase their safety, or as part of the intervention, they can help that person at risk create a safety plan. We also do what's called Empowering and Honoring Life, and that is a program that we are using to introduce diversion activities, workplace preparedness, and programming for high schools and other agencies where kids are to help develop a suicide management program. Thank you.
My name is Eudora Redhouse, and I am the Youth Development and Support Coordinator with the Reach Your Life Suicide Prevention Program. Our program provides youth diversion activities to help youth develop skills in leadership and peer support, as well as it helps them to achieve a higher self-esteem while dealing with emotional distress. NACA's Reach Your Life Youth Council promotes youth leadership and opportunity in prevention, community outreaching, and wellness. The Youth Council is affiliated with the national organization UNITY, which stands for United National Indian Tribal Youth. UNITY promotes personal development, citizenship, and leadership among Native American and Alaskan Native youth. Youth who must be between the ages of 14 and 24 years old to apply.
Hello, my name is Jacob Collody. I'm one of the mental health specialists here at NACA's Reach Your Life Suicide Prevention Program. I help facilitate youth diversion activities and promoting life skills, self-esteem, and peer interaction through team building activities and discussions among detained youth at Coconino County Juvenile Court and the Northland Family Help Center Youth Shelter. Our goal is to increase participation in prevention services for American Indian youth in northern Arizona. So our activities are geared to building personal growth, resilience, and connectedness, exemplifying traits of respect, effort, acknowledgement, communication, and honesty. Also here at NACA's Reach Your Life program, we do facilitate the CAS program. CAS curriculum is geared to building skill training and protective factors among individuals and CAS members to program goals of increasing mood management, decreasing substance use, and improving school performance. In the peer support group, CAS members learn and practice skills of coping, problem solving, and personal control to progress in endeavors of their life and surroundings.
My name is Emelita Burrell. I am the Data and Evaluation Specialist for the NACA Reach Your Life Suicide Prevention Program. Within the Reach Your Life program, we have specific programs and trainings that focus on individual growth and wellness, which Brenda, Eudora, and Jacob previously mentioned. We also offer family healing, connection, and growth through our community events such as the Walk of Hope, the Northern Arizona Suicide Prevention Conference, and the Reach Your Life Honoring Veterans event. With the various components of our program, reaching out and connecting with individuals, families, and community members, another important component of the Reach Your Life program is surveillance and data collection, partnering with local and regional agencies to collect, analyze, and disseminate data.
The Circles of Care project works with community youth, adults, elders, and tribal leaders, and the child serving agencies within the Flagstaff area. The COC project is collaboratively designed to develop a sustainable system of care model. This model will build on individual and family strengths while addressing the mental and behavioral health needs and support of our youth. Thank you.
Hi, my name is Jacqueline Salabai. I'm the project manager for Circles of Care. The Circles of Care project is a youth mental health program that works with the community to construct, promote, and carry out a system of care model. This blueprint is created using real feedback from community members.
It is our desire to increase access for American Indian youth and families of Flagstaff to mental health care services that are culturally appropriate, child-driven, and family-centered, while also increasing investment, support, and knowledge of the systems of care approach within community organizations. We have also set out to decrease stigma and the taboo of mental health in American Indian communities using social marketing. With community input, we will develop a culturally and linguistically appropriate system of care model. And finally, we wish to ensure long-term sustainability of this model.
So what is a system care model?
A system of care model is an organized way for everybody to work together to help kids who are having problems. We all come together to support the family so that the kids don't fall between the cracks. This is what a typical service system looks like.
So what is the process for us involving the community?
This diagram breaks down how the community is involved in the process of creating a system of care model. Looking at this tree, it represents the growth of the project. The soil is the population in which we focus our attention: youth, families, those in recovery from substance abuse and mental illness, the LGBTQA community, parents, and veterans.
Numerous activities have been hosted by COC staff to bring community together. During these activities, we've been able to collect vital data. These activities have had an enormous response, community engagement, and positive feedback.
Data collection methods include, but are not limited to, focus groups, interviews, assessment, input forms, surveys, Community Advisory Board, and Community Advisory Board subcommittees.
In November 2015, Circles of Care conducted a community readiness assessment. Our findings were that the Flagstaff community is in a state of vague awareness when it comes to Native American youth mental health and wellness.
We also conducted key informant interviews with traditional practitioners, healers, spiritual advisors, and elders from 7 surrounding tribes. They have provided information on tribal-specific traditional and cultural practices for mental health and wellness.
We also host dinner and survey nights where we conduct community needs assessment surveys and youth data collection activities. With the parents' consent, I draw and color with the youth while asking questions about their needs in their community and mental health issues. Questions like, tell me the 5 best things about you. Parents are also given a place to lend their voices. Parent cafes have been hosted in an effort to create a supportive parent group for the Circles of Care project. Parents have come up with supportive solutions like do-it-yourself life hack workshops, financial planning and management training, parenting skills, and workforce development.
Each person on the Circles of Care team is vital to our data collection methods. They utilize their expertise to reach our community, so our system of care model is
youth-guided, family-based, community-driven,
culturally and linguistically competent.
Making sure we can measure these outcomes with SMART goals and constant assessment will help our project provide sustainable outcomes.
Our public education plan targets agencies and service providers to present information on our findings.
The social marketing plan was developed to address stigma and taboo related to mental health. Its final outcome will be a youth-driven social marketing campaign in our community.
While our focus and goal is to create a system of care blueprint, we have also been able to provide an array of community-based activities to support our recruitment efforts and a platform to gather community feedback.
The Youth Powwow Dance program is community and culturally based. The program provides for collaboration, partnerships with public organizations to support an effective program that strengthens families and youth while addressing their cultural and linguistic needs. This program is approaching self-sustainability with community members stepping up to run the program after the COC project expires.
The Working in Support of Elders project provides a rich component of intergenerational outreach. It provides community elders a platform to teach youth a cultural or skill-based lesson. Its aim is to connect our past with our future utilizing culturally infused activities and to preserve our culture for our future generations.
In April 2016, the Youth with Creative Minds program will begin in the Flagstaff Unified School District. Through discussions and self-assessments, youth will complete art projects that capture their voices and perspectives on Native American youth mental health.
We thank you for the time that you've taken to see what the collaborative efforts are taking place within the Community Development Department here at Native Americans for Community Action. Thank you and have a wonderful day.